So we're going to do that eyes, ears, nose, mouth, and throat exam. So I'm going to begin by assessing the ears. For adults, you pull the pinna up and back, and you use the otoscope to assess for the tympanic membrane. Make sure it's pearly gray, and on the right side, the cone of light is at 5 o'clock. And then we're going to go to the left ear. Same thing, pull the pinna up and back. Tympanic membrane is pearly gray. The cone of light is at 7 o'clock, and then you're also assessing to make sure that there's no redness, signs of perforation, anything like that. So next, I'm going to test the patient's hearing. I'm going to go behind the patient. This is called the whisper test. I'm going to have you cover your left ear. I'm going to whisper 3 words into your ear, and you repeat those back to me.
Dog, house, cat.
Okay, I'm going to cover the other ear, and we're going to do the same thing.
6, 10, 12.
Good. Now we're going to assess the patient's nose. I'm going to assess the lower portion of the nasal cavity first. I'm going to have you extend your neck slightly back. Checking to make sure that the septum is intact. There's no signs of deviation. It's continuous. Looking to make sure that it's patent. There's no blockages and no discharge or anything like that. Next, we're going to go to the patient's mouth. So I'm going to have you open up. We're going to inspect both sides of the buccal mucosa at the top of the mouth, making sure it's pink and moist. There's no ulcers or lesions. Raise your tongue up for me. Making sure there's none down there. It's pink and moist. The tongue is midline and it's movable. And then we're going to use the tongue depressor. Sit on. And the uvula rises symmetrically. And then next we're going to test the eyes for the extraocular movements. So I'm going to have you look straight at my finger, and you're going to follow my fingers in an H pattern with your eyes only. Good. And then look straight at your nose. Good. And then next I'm going to have you look at, cover one eye. I'm going to have you look at a picture on the wall and then look straight at my finger. Good. Now cover the other eye. Look at the picture on the wall and then look at my finger. Good. So those tests will assess for any double vision. Did you experience anything like that? Convergence, things like that. So then next we're going to use the light. I'm going to test the pupil response to light. And these tests would be better to do if the light's dim or off, but in this case we're going to go ahead and check for it. Good, and then look straight at the light. Straight at the light. Good. And then next I'm going to move into the lateral position, inspecting the retinal vessels and optic disc and looking for the red reflex. So the red reflex is present. There's no signs of hemorrhage in the retinal vessels or anything like that. And then next we're going to move on to the lymph nodes. I'm going to palpate your lymph nodes and tell me if you experience any tenderness, and I'm checking for swelling and then that tenderness. So I'm going to start with the pre-auricular, post-auricular, the occipital at the base of the skull, the posterior cervical, which is on the back of the sternomastoid muscle, the cervical and tonsillar at the angle of the jaw, the submandibular, submental, down the cervical chain along the sternomastoid muscle, the supraclavicular, and you can shrug your shoulders, and then you can feel those better. Did you feel any tenderness or anything like that? Good. Next we're going to inspect the trachea. So I'm going to have you extend your neck slightly back, and I'm just feeling down the trachea. And at the bottom with my index finger and thumb, just making sure it's midline. There's no signs of deviation, and deviation signs would be signs of respiratory issues. So now I'm going to move to the back of the patient. I'm going to have you tilt your head slightly forward, and this is to test for the thyroid. So I'm going to put 2 fingers on each side of the trachea and move down and have the patient swallow. Good. And so With that test, with the patient swallowing, I felt the thyroid move up symmetrically. There was no signs of enlargement or swelling. So everything looks great, and that's it.